Hi, I'm Dr. Joseph Wittering, and today I wanted to talk about the two ways which I see benzodiazepine withdrawal injury present. Um, I'm going to start with the most common presentation, and that's someone who may have been on the medication for several years, and then all of a sudden they maybe change providers and they're working with someone new, and that new person initiates a fairly rapid taper on them. Maybe it's a taper that goes over 3 weeks or something like that. Um, Maybe they tolerate the first two drops pretty well, but by the time they get to the last drop and they stop it, they start developing the full spectrum of protracted withdrawal symptoms. So they'll start having the severe anxiety, the insomnia, the panic, the neurological pain, and the altered sensation, sometimes ringing in the ears as well. And so it's really precipitated by this rapid withdrawal, and that's probably the more common presentation that I see. A slight mix on this is that sometimes it's people who take fluoroquinolone medications when they're on the benzodiazepine, and that kind of precipitates an acute withdrawal as well off the medication because it competes at the receptor site for the benzodiazepines. And some people get injured in that way, but it's less common. So moving on, the next way that I see people develop this injury is much it's kind of different. This is someone that has been maybe on the medications for 5 years, something like that, and all of a sudden they start getting interdose withdrawal. And what that is this feeling where right before your next dose, you start actually developing the protracted benzodiazepine withdrawal symptoms. These people start to feel terrible. It's not just like a regular kind of like craving for the medication, which can happen. They start to develop, things like akathisia. Over time, this feeling kind of intensifies, and within the space of a few months, instead of it being, just right before, their next dose, it's essentially it's most of the time. They've just gradually developed it. These aren't people who have quickly stopped their medications. It's just something that has developed without any changes to their meds at all. So those are the two most common presentations that ways which I see this kind of injury present. I'd love to know your thoughts on this. Did yours present in a different way? If so, please let me know. And thank you for watching.